I'm Dr. Greg Moore, Director of STAMPS Health Services. It is hot out there, there's no doubt about it, but it's summer in Atlanta, and we have to expect that sort of thing happening. Unfortunately, even though we may well be very used to it after many summers, we have to take heat injuries very seriously. About 700 Americans die every year from heat exposure. That the human body is designed to operate in a very tight tolerance right around 98.6 degrees. And just a couple degrees either side and things start not working as well. Enzymes don't work as well, nerve conduction doesn't work as well, muscle doesn't work as well, your brain doesn't work as well. And you get 4 or 5 degrees out of whack and things just start shutting down. That we know that we start having behavioral changes when we are not comfortable anymore. And we're really only comfortable in a pretty narrow range, about 68 to 74 degrees. And when we're outside those ranges, either cold or hot, we start doing something about it, and that's what we need to encourage everyone to do. That when it's cold, we put on some clothes, we get out of the wind, we come inside, we find a heat source. And similarly, when it's hot, we need to start taking off clothes, putting on light-colored clothes, wearing hats, getting in the shade, getting inside, using fans, drinking water. Drinking water is the most important thing because the way that we cool our bodies and stop something serious from happening is by sweating. And evaporative cooling, or the sweat evaporating off our bodies, is very effective. Any of you who have been to the Southwest know they use evaporative coolers or swamp coolers that aren't compressor air conditioners. They just work by evaporation. They work very well in the Southwest because it's so dry and evaporation is very efficient. When it's humid, like it is in the Southeast, like it is in Atlanta, it doesn't work as well, and so that you really have to take extra precautions. That's why fans are good, because they do help in evaporative cooling. That's why it feels good when there's a breeze, even though it's still basically pretty hot outside. So the things to do is to wear light-colored clothes, find shelter, drink lots of fluids, and stay out of the heat as much as you can, or take time cooling. It's even counting on thirst is not always enough to really keep you well hydrated. You have to really kind of push yourself. The studies been done in the U.S. military have shown that in troops in very hot environments, wearing body armor under hot temperatures, the only way they can stay adequately hydrated is weigh themselves in the morning and take breaks throughout the day and drink water until they're back to their weight of the morning. So you really need a lot of fluid. When we lose the cooling system that we have in our body, which is sweat, then things start going bad, and that your body temperature starts going up. The first illness that you get, or the first disorder you get, is heat exhaustion, and that means is that you're not keeping up with able to regulate your body temperature. Your body temperature starts going up to 100, 101. You can still sweat during that, provided that you have enough fluid on board, but you start feeling ill, feeling tired, sometimes feeling nauseated. Patients that you see that encounter that, you'll find that they are cold, they're still cool, their skin is cool, it's usually wet because they're still sweating, but they may start feeling tired, they may pass out, and these patients basically need to be taken to a cool area where they can be further cooled, where they can have more to drink. When that doesn't work, when you start losing the ability to sweat anymore and your body temperature kind of goes out of control and gets past 104 degrees core temperature, then you're sick, and you're really sick, and that's called heat stroke. Heat stroke is a very dangerous disease. You can die. You frequently do die from heat stroke. When you come upon people that are hot, their skin is hot to the touch, and it is dry, they very likely have heat stroke. They are often delusional, sometimes unconscious, sometimes convulsing, oftentimes throwing up, and they cannot really be cared for outside of a hospital. They have to get to a place where you can start IVs, where you can start rapid cooling, where you can do intensive care so that you can avoid death or permanent disability from the impact of having your body temperature above 104 degrees for a prolonged period of time. As you are sweating, that your body is using the sweat to cool your body. So it's not used as much for making urine. And so that we start concentrating our urine as much as we possibly can so that as little water that could be used for producing sweat then doesn't go out when you're urinating. And that you'll see your urine become more and more yellow the more dehydrated and concentrated it gets. That in situations, in training situations, in the military, in cold weather where you can also get very dehydrated, we actually have them line up and pee on the snow and see how yellow their urine is. Obviously, we're not going to be doing that in Metro Atlanta, but keeping an eye on that when you urinate and keeping an eye on the color of your urine, that if you're adequately hydrated, your urine will be, as we say in medicine, straw colored. When you come across someone who is cold and clammy and is starting to feel bad and nauseated, what you need to do is you need to get them into a cool area, get them fluids, monitor them closely, and be sure that it doesn't progress any further. If it gets to a point where their body temperature is significantly raised, that they are starting to have become very sick, convulsions, become disoriented, nausea, vomiting. If they're looking sick and it's hot, then you have to assume that they have heat stroke and they need to get care right away. It depends on how much you're sweating, and how much you're sweating, you don't really always know that. If it's humid, you may be covered with sweat but really not sweating that much because the sweat isn't evaporating. That in a dry climate, you may not know how much you're sweating either because you never feel sweaty, but you're actually losing a huge amount of water. When it's very breezy out, that you'll get evaporation, and you won't notice about that too. So that just kind of drinking pretty much constantly. When you are outside, you have no way of getting the shade. You're in heavy clothes, you have no way of avoiding that. Is that you need to take frequent breaks, you need to go someplace that you can cool off, and you need to pretty much be drinking constantly.